Bismillahirrahmanirrahim. Assalamualaikum and what's up guys? My name is Muhammad bin Muhammad Zaidi and I am from Sepang, Selangor. Currently I am a first year medical student in University of Cyberjaya, my Faculty of Medicine. So today I want to talk about drugs which is antibiotics called Ciprofloxacin. So first we want to know what is ciprofloxacin. Actually, ciprofloxacin is antibiotics that, of course, attack bacteria and also curing bacteria infections in our body, such as urinary tract infection, sinus and respiratory infections, also bone and joints infections, and also treat gonorrhea and also diarrhea. Okay, but first I want to mention that these ciprofloxacin drugs should only be used for the infection that cannot treated by other drugs. Why these ciprofloxacin drugs always be second choice for the antibiotics? It is because these fluoroquinolone groups. What is fluoroquinolone groups? Fluoroquinolone groups is actually a names of a family of antibiotic drugs, which is they fight against the bacteria by interrupting RNA and DNA synthesis of the bacteria itself. So as what I mentioned earlier, why this drugs is very harmful for the patients and always be a second option, because these fluoroquinolone groups drugs will cause many side effects to the patients. So a common side effect of these ciprofloxacin drugs actually is tendon problems that will happen to the patients, and also nerve problem sometimes. So usually these ciprofloxacin drugs are given to the patients by orally, which is by pills or by injections, but the common one is for the by the pills. And next I will talk about the mechanism of action of these drugs. So actually these ciprofloxacin drugs attacks the bacteria by attacking on their topoisomerase 2, which is DNA gyrase, and also topoisomerase 4, but more common for topoisomerase 2, which is DNA gyrase. But how this ciprofloxacin drugs targeting on this topoisomerase? Actually, this drug targets on the alpha subunits of the topoisomerase 2, which is DNA gyrase, that prevents the supercoiling of the bacterial DNA, and also prevents replication of this bacteria. So guys, this is the slides from my lecture notes from Dr. Azli, my pharmacology lecturer in University of Cyberjaya. So, three components here represents the process of supercoiling of bacterial DNA. The upper one is the normal chromosome structure, the middle one is the folded chromosome, and the bottom one is the supercoiled folded chromosome. The quinolone here represents our ciprofloxacin drug that inhibit the DNA gyrase enzyme, so supercoiling of the DNA cannot occur. Alright, enough for the pharmacology of these ciprofloxacin drugs. Next, maybe I will talk about a clinical application of these ciprofloxacin drugs, and also a bit about the side effects or the adverse effects of these ciprofloxacin drugs. Before you taking this medicine, or before you taking these ciprofloxacin drugs, you have to make sure that you are not taking along with the drugs called tizanidine and also theophylline. Actually, tizanidine is a short-acting muscle relaxer drugs, and theophylline is a drugs to treat a respiratory syndrome. And also, you should not take these drugs if you have most allergic reactions of these fluoroquinolone drugs such as gemifloxacin or the other drugs that have fluoxacin in their names. So, what are you going to do if you miss a dose of these drugs? As what we know, all antibiotics that are prescribed by a doctor, we have to finish all of them in the time to get effects of the drugs. If you miss a dose of these drugs, take these drugs as soon as possible as you can. But if it is almost a time for you for the next dose of these drugs, just skip the drugs and not take a double dose of this drug because it will cause a severe effects of these drugs. Alright, some of the side effects or the adverse effects of these ciprofloxacin drugs that usually happen to the patients are peripheral neuropathy, central nervous system effects, hyperglycemia, Clostridium difficile associated diarrhea, which is CDAD, abnormal heartbeats, liver dysfunctions, stroke, convulsions, toxic epidermic necrolysis, and also vasculitis. And of course, tell your doctor if some of these side effects become more severe because maybe this drug is not suitable for you. Alright guys, thank you for watching my video, and if you guys have a comment, just put below, and Assalamualaikum and Salam Ramadan. Alright guys, before I end my video, shout out to this YouTube channel named Mechanisms of Medicine. If you guys want to see more video about the mechanisms of drugs, physiology and pathology of the disease, you guys can explore this channel for more interesting video. And not forget to give a big thanks and pleasure to both of my pharmacology lecturer, Dr. Azli and Dr. Jahid, for guiding me in pharmacology. Akhirul kalam. See you guys in the next video, inshallah.